Finding your voice. Finding your voice. One of the most important things a nurse develops over time is a voice. Not just the ability to speak, but the ability to recognize when something needs to be said, how to say it, who needs to hear it, and when silence is no longer acceptable. New nurses are often hesitant to speak up. They may see something that concerns them, but question whether they understand the situation well enough to challenge it. They may fear sounding foolish, offending a physician, upsetting a supervisor, or drawing attention to their own inexperience. That hesitation is understandable. Nursing school teaches us what to assess, what to document, what to report, and what interventions are appropriate. It cannot fully prepare us for the first time we find ourselves in a room where something feels wrong, and everyone else seems comfortable with it. That is where the nurse brain begins to grow. Finding your voice starts with learning to trust what you notice. A nurse spends more sustained time with the patient than almost anyone else on the healthcare team. We see the change in expression before the vital signs change. We hear the difference in breathing. We notice when the patient who was talking easily an hour ago becomes quiet. We recognize when pain is escalating, when confusion is new, or when something about the situation simply does not fit. These observations matter, but noticing is only the beginning. A nurse must also decide what to do with what has been noticed. Sometimes that means calling a physician. Sometimes it means asking another nurse to look at the patient. Sometimes it means repeating the same concern until someone listens. Sometimes it means documenting carefully and following the chain of command. And sometimes it means being willing to become inconvenient. That can be difficult for a new nurse. Healthcare has its own hierarchy. Physicians, administrators, managers, supervisors, experienced nurses, and newer nurses do not always enter a conversation with equal authority. A nurse may know that something is wrong and still feel intimidated about saying so. This is where experience changes us. Over time, we learn that advocacy is not disrespectful. Questioning an order is not insubordination when the question is grounded in patient safety. Asking for clarification does not make a nurse incompetent. Escalating a concern does not make a nurse difficult. There is a difference between being confrontational and being persistent, and finding your voice means learning that difference. Early in my career, I often felt that I had only two choices. I could remain quiet and cooperative, or I could become angry and confront the person I believed was wrong. Experience taught me that there is a third option: professional advocacy. Professional advocacy means staying focused on the patient. It means being clear rather than emotional when possible. It means knowing the facts, describing what you are observing, stating the concern, and asking directly for what is needed. It also means recognizing when the first answer is not enough. A nurse may hear, "That is normal," but if the patient does not look normal, the nurse still has a responsibility to continue assessing. A nurse may hear, "The doctor already knows," but if the patient is deteriorating, the nurse still has a responsibility to communicate the change. A nurse may hear, "We have always done it this way," but that does not mean it is still the safest way. Nurse brain develops when we stop assuming that authority and correctness are always the same thing. This does not mean distrusting everyone around us. Good nursing depends on collaboration. Physicians, nurses, therapists, pharmacists, aides, and other professionals all bring different knowledge to the patient's care. But collaboration works only when people are willing to communicate honestly. A nurse who is afraid to speak cannot advocate effectively. There is also another side to finding your voice. We must learn to control how we use it. Anger can be powerful information. It can tell us that something violates our values, or that a patient is being treated in a way we find unacceptable. But anger alone rarely creates the best outcome. A nurse who reacts only from anger may lose credibility or become the center of the conflict. The goal is not to win an argument. The goal is to protect the patient. That often requires discipline. Instead of saying, "You are ignoring this patient," we may need to say, "Her pain remains 8 out of 10, despite the medication given 40 minutes ago. She is still moaning and unable to rest. What would you like us to do next?" Instead of saying, "This order makes no sense," We might say, "I want to clarify this order because it differs from what I expected based on her current condition." Instead of accepting a vague response, we may need to ask, "At what point would you like me to call you again?" The more specific the communication, the harder it is for the concern to disappear. This is part of professional maturity. It is also part of courage. Some nurses are naturally outspoken. Others are quieter. Finding your voice does not require becoming loud. It requires becoming clear. The strongest nurses I have known were not always the most forceful people in the room. Often they were the ones who could calmly say, "I'm concerned about this patient," and immediately make everyone pay attention. That kind of authority is earned. It comes from experience, preparation, observation, and consistency. It comes from being right often enough that people learn to listen. But no nurse should have to wait 20 years before speaking up. A new nurse may not yet have the pattern recognition of an experienced nurse, but new nurses still see things. They still notice changes. They still have questions. They still have a responsibility to raise concerns. The mature response from experienced nurses should not be to silence them. It should be to help them develop the reasoning behind what they are seeing. This is how nurse brain should be passed forward. Not by saying, "You will understand someday," but by saying, "Tell me what you are noticing." Then asking, "What concerns you about it?" Then helping that nurse decide what to do next. The ability to speak up grows from being taught that your observations have value.